Ahead of Breast Cancer Awareness Month, Dense Breasts Canada has launched a photo exhibit of breast cancer survivors, and they're urging people to check it out. We've got more on that coming up. Breast Cancer Awareness Month begins on October 1st, and Dense Breasts Canada has launched a powerful online photo exhibit of people who've had breast cancer, urging others to get to know their bodies, get checked, and advocate for themselves. Annie Slide is the Director of Advocacy and Education with Dense Breasts Canada. Thank you so much for coming in.
Thank you for having me.
Now, we can see some of the people behind me, on the screen behind me, that are part of the campaign, 31 people in all with different stories. But tell me, what is their message?
Well, our participants are really from different ages. They go from 26 years old to 73 years old at diagnosis, different ethnicities, men, transgender. So their message through telling their stories is, I want you to know, you who didn't have breast cancer, here's what I want you to know. I want you to know that it could be you. I want you to know that you're never too young to get breast cancer. You're never too old to get breast cancer. You don't need a family history to get breast cancer. In fact, approximately 85% of people who develop breast cancer do not have a family history. I didn't have a family history. So that's pretty much the message. I mean, I never thought it was going to be me. I'm sure they never thought it was going to be them. It could be anyone, and we just want people to know their bodies and get the screening that they need and be proactive.
And as you say, you had breast cancer,
yes.
A very aggressive kind
yes.
of breast cancer. You have dense breasts.
I had dense breasts, yes.
And as a result, I mean, walk us through how difficult it is to achieve a diagnosis as a result of having dense breasts.
So in my case, I had a mammogram at 40, and I was told that everything was fine. Not long later, just a few months later, I felt a small lump. Going back to my doctor, he examined me and said, well, your mammogram was normal, so you're good. It's just a gland, it's a cyst. So I believed him. I figured if my mammogram is normal. What I didn't know is that I had very dense breasts. And what happens with dense breasts is that dense tissue appears white on a mammogram. So does cancer. So little did I know, my mammogram was white on white. After the diagnosis, that took about 1.5 years. There was a long delay. I was told that looking for cancer on my mammogram was like looking for a polar bear in a snowstorm. We didn't see anything, but nobody told me. In Quebec, that's a problem because women are not directly told their breast density, and that also increases the risk of developing breast cancer, which I didn't know that either.
So is that something you recommend to people then to you know, when you go for a mammogram, ask about your density, and then if your breasts are dense, what do you do then?
Supplemental screening. Supplemental screening, we know that, I mean, this is from the experts, that ultrasound and MRIs will find cancers that were missed on a mammogram in women with dense breasts. The mammogram is still important, but if you're told you have dense breasts, you know, advocate for supplemental screening and do your self-exams very regularly. A normal mammogram doesn't mean that there's no cancer if you have dense breasts.
And here in Quebec, women over 50 do have screening, regular screenings, but if you're younger than 50, what do you do in that case? Should you ask your doctor when you go for your exam, you know, I have dense breasts, I would like a mammogram, or if you don't have dense breasts, maybe you want a mammogram anyway?
You can only find out you have dense breasts through a mammogram. So that's the radiologist that looks and then determines the breast density. Screening should start at 40. 50 is too late. The experts all agree that 40 is when the prevalence of breast cancer increases more significantly. So 40 should be, and it's a woman's right in Canada, according to the guidelines, to get screened as of 40. In some provinces like Quebec, you'll need a medical referral. The doctor needs to give it to you. It's your decision, it's your choice. And, you know, don't take no for an answer. If you choose to start screening at 40, you know, push for that referral. And if after, you know, ask your doctor, do I have dense breasts? If you do and you want supplemental screening, push for supplemental screening. You know, unfortunately, and you'll see from these inspiring stories and tragic stories that, you know, some women had dense breasts, didn't know, and got a more advanced diagnosis like I did. So it's important to really know our risk and be proactive.
I really appreciate you coming in and raising the awareness. Thank you so much.
Thank you so much.